Now we'll be discussing a very interesting comparison between drug diclofenac and the etoricoxib. Now both these drugs are extensively used for pain, but there is a slight difference when to use these drugs. Now we know diclofenac, it is a COX inhibitor and it has excellent pain relieving property, anti-inflammatory property as well as antipyretic, means it is an excellent drug for fever as well because it is an anti-inflammatory drug. The same is with etrocoxib. It is also has one of the excellent analgesic property. So pain reduction is significant with etrocoxib. The anti-inflammatory property is there with etrocoxib as well, and it also has fever reducing properties as well. Now this diclofenac has half-life of only 2 hours. That is the reason why the duration of action of this diclofenac wears off around 6 to 8 hours after giving this injection or tablet. Whereas with etoricoxib, the half-life is around 24 hours. So it is actually a very good drug and which acts for a very prolonged period of time. That is the reason why the number of medicines of etoricoxib that we need to give is significantly lesser. So when it comes to the timing, etoricoxib is much more better compared to diclofenac. Now, what is the best feature of diclofenac is it has excellent tissue penetration. So whether it is soft tissues, whether it is muscles, whether it is bones, or whether it is synovial joints, so there is excellent this drug availability of diclofenac compared to the blood. So it has the concentration of drug becomes almost 3 times higher in these tissues compared to the blood or the plasma. That is the reason why it is excellent for osteoarthritis, rheumatoid arthritis, trauma, injuries, sports injuries, post operative pain, because in these things the soft tissue, muscles, bone, and synovial joints are involved. That is the reason why, whenever there are trauma, injuries, pain, post operative swelling is there, tenderness is there, pain is there, back pain is there, muscular pain is there, it has excellent effect. That is the reason why the Volini gel or Moo gel or spray, the main ingredient of this drugs is diclofenac because it has excellent soft tissue penetration. So whenever we want to have a drug which wants to give immediately relief and good relief, diclofenac can be one of the best drug. Etrocoxib also has a very good soft tissue penetration. So it is also one of the good drug for osteoarthritis, rheumatoid arthritis, for soft tissue injuries, sports injuries, in dental surgeries or in dental pain and ankylosing spondylitis. The benefit of this etrocoxib is most of the time you'll hardly need to give this medicine once or twice a day because the half life is pretty good. It is around 24 hours and it is almost as good as diclofenac. I personally find both these medicines as good as, or they are almost have if equal efficacy. So this was all about diclofenac and etrocoxib. The only thing is the diclofenac has is a bad drug whenever it comes to acute kidney injury. So if anyone who has a creatinine of more than 1.5 milligram per deciliter, then I would be really cautious and I will definitely try to avoid this drug to prevent the renal injury. It also has shown to worsen heart failure. So any patient who are post CABG or those patients who have high blood pressure or those patients who have heart failure with reduced ejection fraction or those patients who have angina, means those patients who have high risk of heart failure or those patients who already have heart failure with reduced ejection fraction or diabetes or hypertension, we would definitely try to avoid diclofenac as much as possible. Same is with etrocoxic, but the risk of these problems is significantly lesser with etrocoxic when compared to diclofenac. So this was all about these drugs and thank you.